Colonoscopy is an excellent tool to evaluate disease processes. That means if patients have bleeding, abdominal pain with diarrhea, weight loss, or other general symptoms of concern. But it's also an excellent tool for the screening of patients who are at risk to develop colon polyps or colon cancer, diseases that are preventable today with important interventions, diagnostic procedures, as colonoscopy represents, or I should say colonoscopy represents one of those techniques that allows us to screen. Now, screening is the standard of care for anyone, even if the person is not at risk after age 50, because as we get older, both females and males are at increased risk to develop these little growths that we call polyps. The majority are benign, but some may not be. And if you can pick this up, find this change early on, prevent these little polyps from becoming larger ones and migrating into a malignant type lesion, that means cancer, you can really save a life. Now, so if we start considering what are the indications for colonoscopy, first, clearly screening in someone who's healthy and no symptoms, more so in someone who has a family history of colon cancer, colon polyps, and it's important to do it in those individuals and know when their relative had colon cancer or colon polyps, because then one would start at a younger age. So there we are for the screening. For diagnosis, it's important in the evaluation of patients who are bleeding, who may well have Crohn's disease, ulcerative colitis, diverticulitis with or without bleeding, areas of narrowing in the colon that allow us to evaluate that further and prevent cancer as well if the cancer is causing the symptom leading to the area of obstruction. Colonoscopy also allows us to treat patients. It allows us to remove polyps as long as they're not very large or malignant already. Some of them can even be removed with today's techniques, even when they are large. So there you are, colonoscopy can prevent diseases from progressing further. It's an outpatient procedure with today's techniques. It doesn't take long. Patients are medicated, made to feel comfortable, and it can be done without any untoward side effects, considering the fact that any technique that is invasive has a potential risk. So the physician has to weigh the benefits versus obviously the risks of any technique. Overall, it's been an excellent adjunct to our evaluation, care of all our patients, and it does prevent colon cancer. 150,000 patients or more a year in America develop colon cancer. So if we could evaluate our patient population at risk or preventive, from a preventive point of view, do it after age 50 as a screening technique, we will clearly modify the history of colon cancer in this country and in the world.